season. So it can, oh, what did I do here? Okay. So for today's presentation, I'm going to go over some, again, somewhat complicated stuff, but I do, some of this might be review for some of you, some of this might be brand new. I want to try to make sure that we're all on the same page. So I'm going to talk a little bit about Medicare and MediCal. Well, first I'm going to start with Medicare. So Medicare eligibility, benefits, Part D. And then I'm going to talk about Medi-Cal eligibility and sort of how Medi-Cal helps bridge some of those gaps in Medicare coverage and how they work together. Because they are two very different programs, I think it's important to have some baseline knowledge about how they each work separately before we talk about how they work together. So first, who's eligible for Medicare? Typically the folks that we talk to for the most part are people who are 65 and older, who become eligible for Medicare when they turn 65 because they have paid into the Social Security system long enough, or at least paid the Medicare payroll tax long enough to qualify for free Part A coverage. So that's the hospital coverage, which I'll mention again in a moment. So typically most people become eligible for Medicare when they turn 65. Many other folks that we talk to also become eligible for Medicare due to having a permanent disability and receiving Social Security disability insurance for at least 2 years, 24 months, or have ALS or end-stage renal disease. So you can become eligible for Medicare before age 65 as long as you have been receiving SSDI, Social Security disability insurance, for at least 2 years or have one of these conditions. Otherwise, everyone else becomes entitled to Medicare for the most part when they turn 65. So I'm going to be mentioning a little bit about these different parts of Medicare as we get further into the presentation. So I want to make sure that everyone knows what I'm talking about. So Part A, which is the one that most people qualify for free, so no monthly premium, is the hospital coverage. So that's inpatient hospital stays, home health care, skilled nursing care in a skilled nursing facility, and hospice. So that's Part A. Part B is the outpatient coverage. So when you go to the doctor, if you have tests done, if you get preventive, cancer screenings or mental health services, that is all covered under Part B, which does have a monthly premium, which I'll talk about in a minute. So even if somebody has paid into the system long enough to qualify for free Part A, there is typically a monthly premium for Part B. We'll talk about how Medi-Cal helps people avoid having to pay that. And then finally, there is Part D. So D for drugs. So that makes it a little easy to remember what Part D is for. So D is in drugs, prescription drugs. So we'll talk a little bit about each of these throughout the presentation. Now, I'm not going to go into a lot of detail about the different Medicare enrollment periods because, as you can see on this slide, it's a little complicated. But the thing that I really want to make clear is that everyone has an initial enrollment period for Medicare when they first become eligible, right? If they turn 65 or if they've been on SSDI for 2 years, there's that initial enrollment period. If someone misses their initial enrollment period, then there are really only specific time periods every year that somebody could enroll into Medicare for the first time. So keeping track of enrollment periods is something that can be pretty complicated when it comes to Medicare, which is very different from how the Medi-Cal program works. And I'm sorry, I am working from home. You might see my cat. He's up on the table here, so just bear with me if he ends up making any noise. But I also wanted to highlight that, right now we're about to go into the annual election period, which is just for changes to Part D, the prescription drug coverage. It's not for enrolling into Medicare for the first time. So suffice it to say, keeping track of some of these Medicare enrollment periods can be very complicated but it's a lot easier if someone also has Medi-Cal. So we will talk about that in a moment as well. I mentioned that Part B, so that outpatient care, has a monthly premium. Most people pay $148.50 this year. We don't have the 2022 figures quite yet. I think that's coming out maybe this week or next week. I assume it'll go up by a few dollars. So it'll probably be a little over $150 per month for Part B. There can be lifetime penalties for late enrollment if somebody misses that initial enrollment period and doesn't qualify for having those late enrollment penalties waived. Thankfully, Medi-Cal can also help address everything on this slide. If someone's a high income earner, they're not going to qualify for Medi-Cal. I did just want to state that in case, you know, this situation applies to someone on the call or on the training. You know, this is the base premium, but if someone has higher income, it's possible they would be charged more than this. And then in addition to paying on a monthly basis for Part B, there are also other out-of-pocket costs. So there is an annual deductible. Again, this amount is probably going to go up by a few dollars for 2022. And then you may have heard about how Medicare pays for 80% of someone's healthcare costs, and then they're responsible for the 20%. So that's, you know, that's what this means here. And again, this is something that Medi-Cal helps to address. When we're talking about Part D, and I know I'm going kind of fast because I really just want to lay the baseline here for understanding Medicare before we talk about how Medicare and Medi-Cal work together. But in terms of Part D coverage, this is true for anyone, regardless of whether they have Medi-Cal or not. There are two options for how someone could receive their prescription drug coverage. If you pay attention to commercials, TV ads, radio ads, if you get a whole bunch of mail, you might be under the impression that the only option is to enroll in a Medicare Advantage plan. So that option is where you take your Medicare benefits and assign them to a private health insurance plan, and then Medicare pays that private insurance plan to cover you. And that includes your Part A, B, and D coverage, or prescription drug coverage as well. In LA County, all but 2 plans for 2022 are HMOs, which means it's a limited plan network. You are limited to the doctors in that network. You have to, you get your prescriptions filled through that plan. You may have to get referrals to specialists from your primary care doctor and get prior authorizations for certain care. So that's this model. Some of the Medicare Advantage plans certainly do offer additional benefits like dental or vision or, a free gym membership. And, they like to sort of pad the benefits. They are allowed to add additional, supplemental benefits. But one thing that I do want to flag is that some of the marketing for these plans can be really aggressive and also somewhat misleading. And I'll talk a bit more about, marketing at the end of the presentation, especially as we're going into open enrollment, because I think people who have both Medicare and Medi-Cal are specifically targeted. And they often get, information indicating that the only way for you to get dental benefits, because original Medicare doesn't cover dental, the only way you can get it is if you enroll in one of these Medicare Advantage plans, not keeping in mind that Medi-Cal actually provides a lot of these other supplemental benefits at no cost. So I wanted to flag, that there are these two models. So the other model, if you don't want an HMO, is original Medicare, where you can go see any doctor that accepts Medicare. There's no plan network. You're not limited to specific hospitals. It's a lot more flexible. And then you get a standalone prescription drug plan. So the only thing that the drug plan has any impact on is where you fill your prescriptions at the pharmacy, and maybe what your copays are. So this option has a lot more flexibility. Typically, people who have original Medicare do need either to have a supplement plan or to have Medi-Cal. Medi-Cal operates like secondary coverage to address those copays. So I'll talk a little bit more about that in a minute, but I did want to clarify, from the beginning here that a Medicare Advantage plan can sound really appealing, but it's not always the best option for folks, especially if they're not used to having an HMO, especially if you already have doctors that you want to continue seeing or hospitals that you want to continue going to. Sometimes having a Medicare Advantage plan can really complicate access to healthcare or continuity of healthcare, depending on someone's situation. So one of the things our agency can do is certainly talk about what options might make the most sense. We don't pick a plan for anybody. We don't get commission enrolling people into plans, but we can help talk you through which options are the best for your specific situation. So I'm not going to go into a lot of detail about the various coverage periods under prescription, the prescription drug benefit under Medicare Part D, but I did want to flag that the standard deductible for 2022 is $480. That is not something that will apply if someone has Medi-Cal also, but I just wanted to make it clear that for folks that don't have Medi-Cal, there can be a pretty hefty deductible before your drug plan starts paying. So now that we've sort of given a really quick overview of Medicare, I want to talk about the gaps and the costs. So, we talked about Part B. So Part A, most people don't pay a monthly premium. If you haven't paid into this system long enough, it's possible that you could potentially owe a monthly premium for Part A, which can be very expensive. But Part B does have premiums. There's the copays, there's deductibles. Same with the prescription drug coverage, which we just talked about. And then, other benefits that are not covered by Medicare: dental, podiatry, eyeglasses, hearing aids, incontinence supplies, transportation and medical services, and then a big one obviously is custodial nursing home care or personal care services at home like IHSS. So if someone only has Medicare, they are most likely not getting any of these additional benefits. And spoiler alert, you might already be aware of this, all of these things on the right-hand side are covered by Medi-Cal. So what is Medi-Cal? Medi-Cal is the California Medicaid program. It's the health insurance program run by the state that provides free health benefits. And unlike Medicare, enrollment can take place year-round. There are no specific enrollment periods for Medi-Cal. Now, depending on someone's situation, they might qualify for Medi-Cal in different ways or for different Medi-Cal programs. So if someone is receiving SSI, supplemental security income, which has a very low income amount and a very low savings amount that they allow in order to be eligible for SSI, they will automatically get Medi-Cal. So it's linked. They don't have to submit a separate application. It's automatic. Now, these other two programs are ones that we counsel on quite a bit at Center for Healthcare Rights. So the Aged and Disabled Federal Poverty Level Program, I'll talk about a little bit on the next slide. That's for people that are 65 and older or under 65 and on disability. And then there's also something called the 250% Working Disabled Program, which can be a really great option for some folks that are receiving disability income that puts them over the income limit for this Aged and Disabled program. So I'm not going to talk a whole lot about the 250% Working Disabled program today, but if you have questions about it, we can certainly discuss that, or you can reach out to us, or we can schedule another training for you guys, whatever works. But I'm mostly going to be focusing on the Aged and Disabled Federal Poverty Level Program because that's who most of the clients we speak with that's what they're enrolled in. So there's some really good news. There have been a lot of really excellent changes to the Aged and Disabled Federal Poverty Level Program in the last year or so, and then upcoming in the next couple of years. So the first thing is that the income limit went up pretty dramatically last December. So now somebody who is eligible for Medi-Cal up to a certain income level under age 65, they won't get automatically booted out when they turn 65. It's that same income limit for people under 65 and people 65 and older. Those income guidelines do change every year. Currently, in order to be eligible for this particular program, for a single individual, monthly income has to be under $1,482 per month, and they have to have property or savings under $2,000. They don't count a house or a car if you own a house or a car. For a married couple, the income limit on a monthly basis is $2,004, and then the savings or resources have to be under $3,000. That's obviously a very low amount for people to have in savings. I mean, God forbid someone have an emergency, right? I mean, $2,000 is not going to get you very far, depending on what your emergency is. So, other really good news is that starting July 1st of 2022, these resource limits for the Medi-Cal Aged and Disabled Federal Poverty Level program are going up dramatically. So for a single individual starting July 1st, they can have up to $130,000. And then it's an additional $65,000 for every other member of the household. So looking at, this resource limit starting July 2022, it'll be $130,000 for a single person, $195,000 for a married couple. And starting in 2024, that resource limit is going to go away altogether. So we talk to a lot of folks who maybe have, minimal income, but they have a 401k, or they have some sort of retirement savings, or maybe they own a second property that's, I talked to someone recently, they were like, well, I own a very small plot of land in Arizona, and I think the total amount that it's worth is $10,000. That's like, that's going to disqualify you right now, right? And that's so frustrating. So this is changing very soon. July, I feel like, is going to be here before we know it, because the other thing to keep in mind about Medi-Cal right now is that because of the COVID public health emergency, because of COVID-19 and this pandemic, we are in this public health emergency period coming down from the federal government. And as long as we are in this public health emergency, DPSS, or the Department of Healthcare Services, is not allowed to terminate anyone's Medi-Cal benefits. So right now we expect that public health emergency will go at least through the end of this year. I would be surprised, honestly, if it ended on December 31st. I have a feeling it'll probably go at least through January. And then once the public health emergency period ends, then they're going to have to start doing all of the renewals. So we're still figuring out exactly what that unwinding process is going to look like. But for people who have Medicare and MediCal and might be concerned about losing their Medi-Cal eligibility because their income has changed, or they have money in the bank that they didn't have before, the rules are going to look very different starting next year, and especially next July. So I wanted to flag that because we talked to a lot of folks who have Medicare who would really benefit from having this Medi-Cal program as their secondary coverage, but are ineligible because of the resource limit. That's going to be changing. So that's really, really good news for the seniors and people with disabilities and their families, obviously, who we talk to. Okay, so now that we've given a little bit of an overview with Medi-Cal as well, how does Medicare coordinate with Medi-Cal? So if you have both Medicare and Medi-Cal, Medicare is always going to be the primary coverage for Medicare covered services. So the limit in resources, I see that there's a question in the chat. The limit in resources does apply to SSI. The SSI resource limits are not changing. That SSI limits is a federal rule because SSI is a federal program through Social Security. So when I'm talking about on the previous slide here for this resource limit changing, I'm only talking about in respect to this particular Medi-Cal program, not SSI. So unfortunately, the SSI resource limits will continue to be 2,000 and 3,000 unless something changes at the federal level. Okay, so in terms of coordination, so again, Medicare is going to be the primary payer for anything that is covered by Medicare. In addition to that, the state pays the Part B premium. So right now that's about a little under $150 per month. If someone has Medicare and MediCal, they don't have to worry about paying that premium. The state will do it for them. It will not get deducted from their Social Security check. They shouldn't get a bill in the mail. If they do, have them call us or call us. We can help address those issues. Sometimes, for whatever reason, there are weird computer glitches and the payment stops for no real reason. So that's something that we can help troubleshoot. Now, another really huge benefit of having both Medicare and MediCal is that if someone has both, they cannot be billed for any of those copays or deductibles that I mentioned towards the beginning of the presentation. So I mentioned that Part B might have a 20% coinsurance because Medicare only covers 80%. If someone has Medi-Cal, full Medi-Cal, they cannot be charged that 20% coinsurance. If someone is admitted to the hospital and they have Medicare Part A, you know, there could be a Part A deductible for the first night in the hospital, which is like almost $1,500. But if someone has Medi-Cal, they don't have to pay that deductible. The state pays the deductible for them. So that's how those two programs work together in terms of the co-payments. So the doctors or hospitals can either bill Medi-Cal for the co-pays or deductibles, or they can waive it. They can say, look, yes, I'll still see you, but I'm not going to charge you the copay. The biggest thing is that these doctors and hospitals are prohibited under state and federal laws from billing a person with Medicare and full Medi-Cal. That's called balance billing, and it is illegal. So if you have both Medicare and Medi-Cal and you go see your primary care doctor and they say, here's your, $25 copay bill, they're not supposed to do that. And that's another thing that you can reach out to our agency for assistance with. We work very closely with the Medi-Cal managed care plans, which I'll talk about in a moment, to address some of these balance billing issues. And sometimes, unfortunately, doctors will say, look, I really don't normally take people that have both Medicare and Medi-Cal, but if you pay the copay, then I'll see you. I mean, they're not supposed to do that. That's technically illegal, but we do talk to some clients who say, look, I really want to see this one doctor and I'm willing to pay the copay. It's still technically illegal, but it's also, we're not going to interfere with someone's relationship with their doctor if that's someone that they really want to go see. Medication we'll talk about in a minute. So medication is something different. So when we are talking, this is just for Part A and Part B. So the hospital coverage and the outpatient doctor coverage. You are not supposed to get bills or pay anything for the copays and deductibles if you have both Medicare and Medi-Cal. So again, we're just talking about hospital and outpatient doctor stuff. I'll talk about Part D and the prescriptions in a couple slides. Okay. So I mentioned before that there are certain benefits that are not covered under Medicare. So if you are trying to access a benefit that is covered by Medi-Cal, Medi-Cal is then the primary payer because Medicare doesn't cover it. So things like Medi-Cal nursing home care, adult daycare, incontinence supplies, all the things on that list that I mentioned earlier about dental or eyeglasses, hearing aids, since these things are not covered by Medicare, you wouldn't submit a claim to Medicare for any of this stuff. Medicare has nothing to do with, getting access to dental for the most part. So then Medi-Cal would be the primary coverage for these types of additional benefits. And for the most part, these things are run through the Medi-Cal health plans, which I'll mention in a slide or two. But there's a couple of exceptions. So dental is not run through the Medi-Cal managed care plans. Dental might be separate. Same with IHSS, and then certain specialty mental health services that might be sort of carved out of the managed care plan. So when we're talking about Medi-Cal managed care, so we live in LA County, and LA County is one of 7 counties that participates in what's called the Coordinated Care Initiative. That started in 2014. Frankly, it was somewhat of a nightmare. I was not working at Center for Healthcare Rights at the time, but I was working for a disability rights organization and heard lots and lots of horror stories about the way that some of these transitions worked. But one of the things that has come out of the Coordinated Care Initiative is that anyone who has both Medicare and Medi-Cal in LA County has to have their Medi-Cal benefits assigned to one of these managed care plans. Now, the biggest question that we get is, okay, well, if I have managed care for my Medi-Cal, doesn't that impact who I can go see for my doctors for my Medicare? No, thankfully, no. This only really has any bearing. Which plan someone is in for their Medi-Cal only has bearing on those specific Medi-Cal benefits that are not otherwise covered by Medicare. So for example, LA Care, I would say, is probably the biggest one here in LA County. HealthNet is the other big one, and then they have some partner plans. So we talk to a lot of folks that have LA Care for their Medi-Cal benefits. Maybe they have original Medicare for their Medicare coverage. The only time that they really would need to, reach out to LA Care or deal with the LA Care network would be, let's say they need transportation to their doctor's appointment. Well, LA Care or HealthNet, they're going to coordinate that Medi-Cal benefit. But if the question is, oh, I need to see my primary care doctor for my annual wellness visit, do I have to go see an LA Care doctor? No, not necessarily. You can go see any doctor that accepts Medicare as long as they're willing to accept, the Medi-Cal as the secondary or waive those copays. So the Medi-Cal plans, this can be, managed care can be pretty confusing, but I think it's important to keep in mind that these Medi-Cal plans do not have a bearing on which doctors or hospitals you can necessarily go to. And I'm sorry I didn't turn my email off before I started this. You might hear some ringing in the background, but the Medi-Cal plans really help coordinate the Medi-Cal benefits, not the Medicare benefits. So as I mentioned, people who have both Medicare and Medi-Cal do have to enroll in a Medi-Cal plan unless they qualify for some sort of exclusion or exemption. Typically, most folks do not qualify for a medical exemption from the Medi-Cal managed care. This doesn't come up a whole lot because, as I said, when you have Medicare as your primary coverage, the Medi-Cal managed care doesn't typically have much of an impact on how you receive your care. It's really just sort of there in the background to make sure that your copays are being paid, you're not getting balance billed for anything, and then to coordinate any of the benefits that are not covered by Medicare. Now, there is one other option that dual eligibles, or you might hear Medi-Medi, you might hear dual eligible. That's the same thing, right? We're talking, when we say dual eligible or duals or Medi-Medi, that all means the same thing. It means someone who has both Medicare and Medi-Cal. So one other thing that happened as a result of this coordinated care initiative, which is ending at the end of next year. But one other thing that came out of this is the idea of these coordinated plans where the Medicare benefits and the Medi-Cal benefits are combined into one plan. So instead of having, original Medicare and LA Care, or original Medicare and Molina, or instead of having a Medicare Advantage plan and a separate Medi-Cal managed care plan, it combines it all into one plan. There are, I think, only, five Cal Medi-Connect plans in LA County. So there's an Anthem Blue Cross, there's Blue Shield Promise, there's Health Net, LA Care, Cal Medi-Connect, and Molina dual options. Now, we do counsel on Cal Medi-Connect plans, and I'm sure that there are probably a lot of people that are very happy with their coverage. Because of the nature of our work, we typically hear the complaints. We hear from the people that need help getting back into what they had before because they made a mistake when they enrolled, or maybe, again, going back to this marketing issue, they might have been misled that they would be able to continue to see their same doctors. That unfortunately does come up a fair amount. So I'm sure that there are some folks for which a Cal Medi-Connect plan does make sense and is helpful. From my perspective, we are supposed to be neutral, but I will share with you that, I think it's a really good idea to explore all of the options before deciding whether to make a change into a Cal Medi-Connect plan, because the plan networks, the provider networks can be so different from what someone might have been enrolled in before. And the last thing you want, if somebody has a chronic health condition or a complicated health condition, you want to make sure that they continue to see their doctors, right? Assuming you like their doctors, or that they like their doctors, and they have a treatment plan. You don't want to disrupt their care by making a huge change necessarily. So that's something to keep in mind about Cal Medi-Connect. The goal is to provide better care coordinations. There might be some extra benefits. Of course, I say all of that with the caveat that Cal Medi-Connect is going away at the end of 2022. So, talking about disrupting care, now might not be a great time to enroll in a plan if you know that at the end of 2022, you would have to make another change. So the way that it's going to change, it's the Coordinated Care Initiative, CCI, that's going away, that's ending. We are transitioning into what's called CAL-AIM, the California Advancing and Innovating Medi-Cal Initiative. That is a mouthful. So that is going to be starting at the beginning of 2023. Basically, the biggest change is that instead of having these coordinated plans where the Medicare and MediCal are all together in one plan, it's going to go back to having two separate plans, but they're at the same company. One is a Medicare Advantage special needs plan. The other is a Medi-Cal managed care plan. They're aligned so that the benefits coordinate better in theory. But we'll know more about that in the coming year. And I'm sure we'd be happy to do another training, as we approach the end of 2022 on those topics, because it's very complicated, as you can imagine. So again, going back to how Medicare and Medi-Cal coordinate, as I mentioned, the Medi-Cal plans, so those, LA Care, Health Net, they do not manage the Medicare benefits. So even right now, if someone because Health Net does sell Medicare Advantage plans, someone could have a Health Net Medicare Advantage plan and a Health Net Medi-Cal plan, but they don't totally coordinate. So the Medi-Cal plan does not have any impact on the Medicare benefits. Medicare providers do not have to contract with the Medi-Cal plan to provide Medicare covered services. So going back to the example I gave before, where let's say someone has original Medicare, so they're using their red, white, and blue Medicare card, and let's say they have LA Care as their Medi-Cal managed care plan. They go see a doctor, and the doctor says, well, I don't contract with LA Care, so I can't see you. That's that to me, that sounds incorrect. The issue shouldn't be whether they contract with the Medi-Cal plan. The issue is whether or not they are willing to bill Medi-Cal for the copays and deductibles, not whether or not they contract with that specific plan. Medicare providers do have to bill the Medi-Cal plan for those copays and deductibles, as I mentioned, and they are not allowed to bill dual eligible patients for the copays. So that is a really big one. It always breaks my heart when I hear from folks that say, oh, well, I got this big bill from the doctor and I didn't want it to go to collections, so I paid it. And it turns out they shouldn't have been billed in the first place. Then, they might be able to get reimbursed, but we understand that that can be a pretty big hardship. So if you're in a situation where you or a loved one has both Medicare and MediCal and receives some sort of balance bill, that's another situation where I would recommend reaching out to us, because we can help troubleshoot before you, worry about paying out of pocket for something that you might not actually owe. Okay, so talking about Part D. So I know that there were some questions in the chat about, well, what about copays for prescriptions? So, dual eligibles are not allowed to be billed for copays or deductibles at the doctor's office or at the hospital. Unfortunately, at the pharmacy, it is a different story. And this can be particularly frustrating for people who have Medi-Cal first, because under Medi-Cal, you don't pay a copay at the pharmacy. Medi-Cal covers prescriptions for free. If someone then becomes eligible for Medicare and they have both Medicare and MediCal, you do automatically qualify. You're deemed eligible for what's called extra help. It's the low income subsidy, and it sets the copays to a very low amount. These are the amounts for 2021, and for 2022, I believe it's going up to $1.35 for a month supply of generics, $4 for brand name prescriptions. So that's the maximum that a dual eligible patient or beneficiary should pay at the pharmacy for a 30-day supply of their prescriptions. Now, unfortunately, I talked to some folks who, they have SSI. Their income is like $950 a month. They have Medi-Cal only, and then they become eligible for Medicare. Once they have Medicare, they are required to have a drug plan, and they are required to fill their prescriptions through Medicare. So that can be a pretty dramatic change, going from paying $0 for prescriptions. And I spoke with someone a couple months ago, and she said, well, I take, 8 or 9 different prescriptions and I get SSI. All I get is $950 a month. So going from 0 to, $10 or $12 can be pretty dramatic. And I wish that I had a better solution for that. I think this is a pretty big gap in our system, unfortunately, but I did want to flag this because it does often take people by surprise that there is a copay at the pharmacy for people who have both Medicare and MediCal. Now, as I mentioned, people with Medicare and full Medi-Cal do have to enroll in a Part D drug plan. And if you don't select one, Medicare will assign the drug plan automatically. And I see that there's in the chat, someone said, for my mom's medications, we've paid up to $70. They should see at the pharmacy, if someone has extra help, that should show up at the pharmacy. If they're still saying that the copay is $70, my guess is that either the computer system has not been updated to reflect the extra help, or more likely, it's a prescription that is not on the formulary for the drug plan that person is in. It might not be a covered prescription. So if you're running into a situation where you know that your loved one has extra help, that they have Medicare and MediCal, that these are what the copays are supposed to be, I would confirm, is this a drug that is actually covered by my plan or by my loved one's plan? because unfortunately there are some drugs that just aren't covered by Medicare. You know, a lot of brand name drugs, you know, there's a preference for prescribing generics. So if you run into a situation at the pharmacy where they're saying, no, the copay is $70, no, the copay is $200, I would confirm with them that I would show the Medi-Cal card. That is usually something that will trigger for them that this person is supposed to have extra help. You can also call our agency. And usually prescription drug access issues are things that we might be able to help with same day if it's really urgent, like if you're out of the prescription altogether. If it's, you know, you have a couple weeks supply and they're telling you that it's all this money, that might not be something that we would handle same day, but it, you know, that is something that I would recommend contacting us about, because the other issue is that if it is something that is not covered by the drug plan that your loved one or your mom or whoever it is that they are in, we can either search for an alternative drug plan that might actually cover that drug, or we can talk to you about talking to his or her doctor. Whoever the prescribing doctor is may need to ask for what's called an exception request, which is basically asking the drug plan for special permission to prescribe a medication that's not on the approved covered list of drugs, the formulary, because that is a specific drug that, you know, they need for whatever medically necessary reason. So those are things we can certainly talk about, but I'm guessing that, you know, if you're being charged more than this at the pharmacy, the issue is likely either that the drug is not covered under their plan, or the pharmacist does not have updated information about their extra help status. So for 2022, there are 5 drug plans that are available to people with extra help. So people who have both Medicare and MediCal, or just have extra help separately. These are the 5 plans that are available for no monthly premium. You can enroll in any drug plan you want, but if somebody has Medicare and MediCal, most of them, you know, tend to enroll in these plans that have a $0 monthly premium. Oh, and I see in the chat, can you help with navigating about the exception? Yes. So if you have questions about exception requests, you know, we can talk you through what that process looks like, but typically that's something to discuss directly with the prescribing doctor, and they should have experienced that. It's something that's very common. Many doctors do help. They're the ones that can actually say why it's medically necessary to have that specific type of medication. So they're going to be the best advocate for explaining to the drug company or the drug plan why that drug is necessary. And, you know, the forms are pretty straightforward. It's typically not a big deal for the prescribing doctor to have someone in their office help with faxing that in. They usually send it by fax. But yes, we can absolutely talk to you about, you know, what that process looks like if you have questions. So in terms of these drug plans, you know, these are, again, not the only ones available, but these are the ones that are available starting in 2022 with no monthly premium. There were 2 other drug plans listed on this list for 2021. So if you or your loved one has the AARP Medicare RX Saver Plus, Medicare RX Saver, whichever the one with the $0, but it's AARP, or Cigna, the Cigna $0 plan, those are leaving the market. So you may need to look and see what the other options are here in terms of the coverage. Or my understanding is that, you know, if somebody has one of those 2 plans that's going away for 2022, they might get automatically enrolled into one of these ones instead. Because again, these are the plans that are available with no monthly premium. They're not going to move you into a plan that you would have to pay for if you have extra help. Okay. So when can dual eligibles make changes to their coverage? You know, it's pretty, these enrollment periods can be pretty complicated, but I think one of the things that's really helpful for people, so, you know, some of these enrollment periods are the same if you just have Medicare, right? So everyone has their initial enrollment period. I talked about this annual election period at the end of the year for Part D, also known as open enrollment. Everyone has that. If someone starts the year in a Medicare Advantage plan on January 1st, they also get another enrollment period to make changes during the first quarter. Everyone can get a special enrollment period if they have, you know, one of these major life changes. But the biggest thing for dual eligibles, so for people with Medicare and Medi-Cal, is having extra help gives you additional opportunities to make changes to Part D coverage once per quarter for the first 9 months of the year. So we frequently talk to folks, it's a blessing and a curse, because on the one hand, if someone has a changing health need, or if they get prescribed new medications and their current drug plan isn't working for them anymore, they can make changes, which is great. They're not locked in for the whole year because maybe they have a more complex situation. The downside is that I think this is part of what is contributing to some of this really aggressive marketing, because these plans know that folks who have Medicare and Medi-Cal can change their coverage basically up to 4 times a year, or even more, depending if they leave or, you know, enter a nursing home or have any of these other situations. You know, we do sometimes talk to people who've been in 4 different plans in the last, you know, 6 months because of how much, you know, they've just been bouncing around, and that can really cause problems. But it can be really helpful. This doesn't mean that someone is locked in for the whole year. They might be able to change to better a coverage that might make more sense for their situation, depending on how things go. So that extra help special enrollment period is really helpful. In terms of the Medi-Cal coverage, so just those Medi-Cal managed care plans, that can be changed anytime. There's no enrollment periods for Medi-Cal. If you're with Health Net and you decide, well, you know what, I'm not happy with Health Net and their customer service, I want to switch to, you know, LA Care, or maybe you like Kaiser and you have Kaiser for your Medicare Advantage plan and you want to make sure that your Medi-Cal plan will align with it, and so you want to get into the Kaiser Medi-Cal plan, you know, that can be done any time of year. Those CalMedi Connect plans, you can join or leave any month of the year. So there's a lot more flexibility with the Medi-Cal managed care, and those changes are done through healthcare options. So what if a dual eligible makes a change to their Medicare coverage and doesn't select a Part D plan? So let's say someone had a Medicare Advantage plan, one of those Medicare HMOs, and they decide, you know what, this isn't working for me, I'm going to change, I want to switch back to original Medicare. And let's say they don't pick a drug plan. So Medicare, if they have extra help, which they should if they are dual eligible, they will automatically get enrolled into the Limited Income Net program, or LINET. I believe that stands for Limited Income Newly Eligible Transition. I think that's what it stands for. So the LINET program basically gives people who have extra help the opportunity to be able to fill their prescriptions at the pharmacy, even though they're not enrolled in a drug plan yet. So it is temporary. It is not something you can stay on forever. I think the maximum amount of time I've seen anyone be on LINET is maybe 3 months, because there were some issues with their transition. And then once someone is in the LINET program, if they don't select a drug plan, Medicare will automatically assign them to one of those plans with the $0 premium. Now, I've alluded to this several times already, but I think it's really important to say as many times as possible, especially at this time of year. You know, Medicare marketing scams target people with Medicare and Medi-Cal year round, because people with Medicare and Medi-Cal have so many opportunities to make changes to their coverage. Sorry about that. You know, I think that they see some of these scammers really see dual eligible enrollees as the most vulnerable, perfect targets for especially some of this marketing fraud. So unfortunately, we hear from a lot of people who tell us that, they got a lot of phone calls from some agent that was really pressuring them to make changes to their coverage and kept telling them that the only way they could get, XYZ benefits is if they enroll into this plan or that plan. And it turns out some of this stuff, like I mentioned at the beginning of the presentation, they'll be told like, oh, the only way you can get this benefit is if you enroll in this Medicare Advantage plan. And it turns out the person has Medi-Cal and they already have access to transportation, or they already have access to dental care. So, it gets pretty frustrating when you're a caregiver and maybe your loved one is the one answering the phone, because we do hear from, adult children who are caregivers for their elderly parents. And we find out that, well, mom has dementia and she just watches TV all day and she sees all these commercials. And so she just calls. She calls, and this is an example of one of those people I talked to who had been in like 5 different plans in a very short amount of time. And so when I got in touch, and she called us, at least she called us somehow. But I called and I talked to her son, and he was like, well, what are you calling about? I finally figured out my mom's benefits. They're where I want them now. She has original Medicare and a Part D plan and her Medi-Cal separate. He's like, I don't want to change her coverage again. She has dementia and she keeps calling to make changes. She doesn't know what she's doing. And that can be so tough because at the end of the day, maybe you can't always control whether or not mom or dad are answering the phone when you're not home, right? Like I talked to someone else a couple of weeks ago who said, oh, an agent from the LA Care, Cal MediConnect called while I'm her power of attorney and I have, I'm her authorized representative for Medicare, but they called while I was out of the house. And she said, oh yeah, I changed my coverage. It sounded really good. Oh, it can be we clean up a lot of those messes. So if you run into a situation like that, please do reach out to us. But something to keep in mind that, plan agents cannot approach people in common areas. They should not be going door to door. They should not say that they're calling on behalf of Medicare. They should not be making unsolicited phone calls. And then they should not be providing information that is inaccurate or misleading. So if you have been told, or if your loved one has been told, oh yeah, your doctor is definitely in this plan network, you can definitely switch plans and keep your same doctor. And then it turns out that that's not true. Not only would potentially your loved one still be eligible to make a change to their coverage because of their special, the special enrollment period with extra help, but, if they have been misled about, the plan network or the hospitals or anything about the plan, that actually also qualifies them to file a complaint and get out of that plan because of misrepresentation of the marketing. So we can help with filing those complaints. We can help with fixing benefits to get back into what someone had before. We work with the Senior Medicare Patrol, which handles Medicare fraud. That does amount to fraud. If someone is being misled to join a plan, they've been told that something is true that isn't, that does potentially amount to fraud. So we want to make sure that, this information is being tracked so that it can hopefully be limited. I would love to see changes to those marketing rules, but for now, this is what we have to work with. So here's our phone number again. I'm 2 minutes under the wire here. So, again, our phone number, 1-800-824-0780. We are here to help. We are happy to help with any issues related to Medicare and MediCal, how they work together. If you're having issues at the pharmacy where a drug is not covered, or you're being charged an extra, additional copay beyond what you think you should be paying for the drug, again, that's something that we can certainly counsel on and provide some guidance. So in the minute or so that's remaining, I'm happy to answer any other questions that there might be. If there are any. Otherwise, I definitely recommend calling and requesting an appointment to speak with one of our counselors, because we all go through, like I said, a pretty rigorous training process. So we're here to help however we can. And even if it's not now, I definitely recommend writing our number down in case issues come up in the future. Especially with this COVID public health emergency and how things are going to be changing next year with Medi-Cal. I would imagine that probably in the first half of next year, there might be some questions coming up. And then as we go into the second half of the year with Cal-AIM and some of these changes from the Coordinated Care Initiative into Cal-AIM, again, we can be a resource to you as that transition starts to happen. And it might not impact you. It might not impact your loved ones if they don't have a CalMedi Connect plan. They might not see any major changes. But for some folks, I think it will be a little confusing, and some of the notices that will get sent out by the Department of Healthcare Services undoubtedly will be confusing. So you're always welcome to give us a call.
Thank you so much. That was really a great presentation overview. So much really helpful information. And it resonates because I'm at the daycare and we had a participant yesterday who was receiving calls on his cell phone from somebody that we suspect who has dementia, who we suspect was trying to get information and possibly encourage him to change a plan. So fortunately, our staff was able to intervene, and then his daughter was informed. But yeah, these things definitely happen. So anyway, such wonderful information. Thank you so much for this presentation.
Oh, you're welcome. You're welcome. And Anna, I'm happy to send you the slides if that would be helpful.
It would be very helpful. I would love to have them, and even for our staff, because some of the updated information we don't have. So that would be really great.
Great.
Thank you so much.
Oh, you're welcome.
Thank you. And then in terms of the gift card, the person that I have is, I hope I don't mess up the last name, but it's Alina Ketelekian. Are you still here, Alina? Okay, well, if you are, I will just send me a quick message, but I will get that to you later today. Thank you everybody again for joining us. I hope these sessions are helpful. I know they've been great, informative for me as well. So thank you so much to everyone who's participated. Tomorrow, we do have another tomorrow at noon. It's our occupational our occupational therapist, Loretta Heisler, will be doing a relaxation and seated Tai Chi group for caregivers. So I really hope that some of you will be able to join us for that. And with that, unless anybody has any questions, I will close. Thank you again. Thank you so much.
Thank you.
Bye.
Bye.